This is the tale of two X-rays. This is the same person, however, these X-rays were taken 4 days apart. This one was taken 4 days before this one. Now, if you notice here, the first thing you want to look at when you look at an upper cervical listing, we have to have proper films. Number one, we look at film position. If you look at this, you can see the spaces of the eye orbits, that's in pretty good position there. If we look at this one right here, we can see the orbit's up here, so we see some rotation because we see less between the external eye orbit on the right side than we do on the left side, meaning the head does have some rotation. But there's something even more important when we're looking at patient position for this X-ray, for the APOM, full cervical, is the position of the teeth. The teeth should come down and strike the top third of the atlas. When I have doctors send me films and they have a confusion on their listings, you'd be surprised at how many times they send me a film that the teeth are considerably higher than the atlas lateral mass. The problem with this is if the teeth are higher than the lateral mass, it creates rotation and creates different positions of the foramen magnum, and you will not get a correct, accurate picture of what you're looking at. Let's take a look, for instance, at this picture. On this picture, you see where the teeth strike the top third of the atlas lateral mass right there. That's an excellent position. Also look at where the eye orbits are. Everything's intact. You can see this is a good positional picture. Now when you look at this, you can clearly see the foramen magnum. We can outline it right here. It's in good position if you drew that in the arcs, or if you follow the 5-step method we teach in the next webinar, you will see quite easily that this is a left laterality. Now let's go to the other film. On this film, we see the same person, but 4 days earlier. We see the teeth are higher than the lateral mass. You can see that. You can also see rotation here. But believe it or not, this rotation up here is not really what's disturbing this X-ray. Nearly as bad as the position of the teeth. What happened in this case, somebody put the cork in the mouth, or if they didn't have a cork, they opened the mouth, and instead of having the patient in the normal natural position with their chin tucked slightly, what they did was they allowed the head to be in a little bit of extension. When it was in extension right here, it moved the position of the foramen magnum. Now the interesting thing about it is that if you were to draw the arcs, and I'm just going to do this lightly, if you draw the arcs, draw it down here, and then look at the distance between here and there, and so forth, you could possibly call this a right laterality. Now when we looked at the other film, same person, it was very obvious that it was a left laterality. This is a great example of where people can go awry trying to find the upper cervical listing. It starts with X-ray positioning. This patient was adjusted as an ASL. You do not see the lateral here, but it was an anterior superior with left laterality of the atlas. That was the successful listing in this case. Now I invite you now to come to the webinar that we have scheduled for October 2010, where we'll be going over these issues as well as how to get an upper cervical listing. We'd love to have you with us.